Hello students. In today's video we are going to understand the concept of cardiac output. Now in addition to this we will also study the factors that affect the cardiac output. So first of all look at this figure. As you can see here, this is the structure of heart. Now as we all know, when the left ventricle contracts, this oxygenated blood containing more oxygen is pumped into the aorta, and aorta supplies this oxygenated blood to all the tissues of the body. On the other hand, when the right ventricle contracts, it pumps the deoxygenated blood, that is the blood containing more of carbon dioxide, into the pulmonary arteries, and pulmonary arteries carry this deoxygenated blood to the lungs for oxygenation. Now let's understand what is cardiac output. Now cardiac refers to the heart, and output is the amount of blood that is pumped out by each ventricle per minute. Now a cardiac output at rest is normally 5 liters per minute. So we can say that around 5 liters of blood is pumped by the left ventricle into the aorta per minute. Similarly, around 5 liters of the blood is pumped by the right ventricle into the pulmonary arteries per minute. So cardiac output is defined as the amount of blood pumped by each ventricle per minute. Now let's understand how to calculate the cardiac output. Now cardiac output is equal to stroke volume into the heart rate. Now stroke volume is the volume of blood that is pumped from each ventricle per beat or per contraction. Whereas heart rate is the number of heartbeats per minute or number of contractions per minute. Now cardiac output is equal to stroke volume into heart rate. Now stroke volume is 70 ml per beat. That means around 70 ml of the blood is ejected during one contraction. And the heart contracts around 70 times in a minute. So cardiac output is equal to 70 into 70, that comes to 4900. So this comes to 5 liters per minute. So cardiac output at rest is normally 5 liters per minute. So around 5 liters of the blood is pumped by the left ventricle into the aorta per minute, and around 5 liters of the blood is pumped by the right ventricle into the pulmonary arteries per minute. Now this cardiac output can increase to around 25 liters per minute during the exercise. So now let's understand the factors that affect the cardiac output. Now as we know that the cardiac output depends upon stroke volume and the heart rate. So let's first study the factors on which the stroke volume depends. Now first very important factor is the ventricular and diastolic volume. Now during the diastole, the heart relaxes and it is filled with the blood. Now diastole is always followed by the systole, that is the contraction of the heart. So volume of blood in the ventricles immediately before they contract is known as ventricular and diastolic volume. It is also known as a preload. So more is the volume of blood in the ventricles immediately before they contract, more will be the stroke volume, and therefore more will be the cardiac output. Another important factor is the venous return. Now venous return is the amount of blood that returns to the heart through the superior and inferior vena cava. Now look at this figure. Now the heart receives the blood from superior and inferior vena cava. Now more is the volume of blood received by the heart, more will be the volume of blood that is ejected by the heart. So more is the venous return, more will be the cardiac output. Now, venous return in turn depends upon the position of body. It depends upon the functioning of skeletal muscular pump and the functioning of respiratory pump. So, first let's talk about the position of body. For example, elevating the feet. Now, elevating the feet increases the flow of blood towards the heart. So, that increases the venous return and that further increases the cardiac output. Then functioning of skeletal muscles in the leg. Now we all know that the blood returns to the heart by the veins. Now when the skeletal muscles of the legs contract, the deep veins in the legs they get compressed. Now this pushes the blood towards the heart and increases the cardiac output. Another important factor is the functioning of respiratory pump. Now, while breathing, during inspiration, the chest expands and this creates negative pressure within the chest. Now, this negative pressure pushes the blood from the head and from the arms towards the heart. So, this also increases the venous return and further increases the cardiac output. Now, another important factor on which the stroke volume depends is the myocardial contraction. Now, as we all know that the wall of heart is made up of cardiac muscles, myocardial muscles. Now, more forceful is the contraction of these cardiac muscles, higher will be the cardiac output. So, more forceful is the contraction of cardiac muscles, more will be the cardiac output. Now, this contraction of the myocardium or the contraction of cardiac muscles depends upon the release of norepinephrine and epinephrine. So, higher is the release of norepinephrine or epinephrine, more forceful will be the myocardial contraction and higher will be the cardiac output. Now, similarly, increased secretion of thyroxine also increases the myocardial contraction and increases the cardiac output. Another important factor on which the stroke volume depends is the blood volume. Higher is the blood volume, more will be the stroke volume. Less is the blood volume, lower will be the stroke volume. Normally, the blood volume is kept constant by the kidneys. But sudden fall in the stroke volume, for example, can occur because of the hemorrhage or any other reason. Now let's study the factors that determine the heart rate. Now higher is the heart rate, higher will be the cardiac output. Lower is the heart rate, lower will be the cardiac output, because cardiac output is equal to stroke volume into the heart rate. Now heart rate depends upon autonomic nervous system. Now emotional states like anger, fear, anxiety stimulate sympathetic nervous system and this increases the heart rate. On the other hand, stimulation of parasympathetic nervous system decreases the heart rate. Then circulating chemicals, that is the amount of certain chemicals in the blood, also determine the heart rate. For example, norepinephrine, epinephrine. If the concentration of these two neurotransmitters increase in the blood, it will automatically increase the heart rate. Then increased release of thyroxine also increases the heart rate. Then hypoxia also increases the heart rate. Then increased potassium in the blood, known as hyperkalemia, this decreases the heart rate. Then drug like atenolol. Atenolol is a beta blocker. So drug like atenolol that is used for the treatment of hypertension reduces the heart rate. Now besides this, position of body also affects the heart rate. Like heart rate is usually faster in the upright position. Then gender, heart rate is usually faster in women than in men. Then exercise increases the heart rate. Then emotional states like anger, fear, stress, anxiety, they also increase the heart rate. So these are the factors on which the stroke volume depends and the factors on which the heart rate depends. So overall, these are the factors that determine the cardiac output.